YouTube, how you doing? This is Matthew with the Counselors Guild. Today we'll be looking at estrangement when adult children decide to cut off contact. I'll be borrowing heavily from the book Rules of Estrangement by Joshua Coleman, Dr. Joshua Coleman. So let's get into this. So background information on estrangement. Estrangement is a psychological and social phenomenon. From what I hear, it's kind of trending right now, characterized by the deliberate distancing or severance of emotional, social, or familial bonds between individuals, often resulting in minimal or no contact. It typically involves feelings of alienation, rejection, or disconnection, and may stem from perceived betrayal, unresolved conflict, abuse, neglect, or differing values. 27% of parents are estranged from their adult children, which is a big number, which was surprising to hear. But as kids are getting more independent and I think becoming more bold, I don't say bold, but just more, let's say bold, to break that connection with their parents, it doesn't surprise me too much. Most of them are under 35 and mostly millennials and Gen Z, so my age group. I think we're just much more, our generation is much more, I think, just inclined to set boundaries and limits with people we don't want in our lives, people that bring us down or are critical of us. So I think we're just much more open and much more honest with our parents, with our sisters, with our family. Men are slightly more than women. Fathers are more often estranged. The mother-daughter dyad, however challenging, is potentially the most resilient. To complicate matters further, and this is a quote from Coleman, sometimes the cause of the estrangement lies somewhere in the vast desert between where the complexities of each person's personalities, their histories, challenges, and their genetics ping-pong back and forth off each other. And conflict operates less as cause and effect and more like a feedback loop, endlessly amplifying the worst instincts of the parent, adult child, or anyone else. Okay, so it's not black and white. It's a lot of gray, a lot of things going on. It's not usually just one issue. It's very multifaceted in why a child chose to estrange from their parents. It's usually just not one instance. It's multiple instances over time. Okay, so what parents go through during the estrangement? Stages of grief. Again, a lot of this is coming from Coleman. Denial. Refusing to accept the reality of the situation. Your child has a separate perception than you, which is important. Especially therapists, they need to know that the reality your client, maybe the mom or the dad, comes in with is not necessarily the truth. It is their reality, or what they saw or what they think is going on. Defensive, dismissive, argumentative. Use old parenting techniques. Telling the child what to do and what to feel. So you can see that it's gonna, on their own, it's gonna be hard to reconcile, especially when the parent thinks they didn't do anything wrong, or they just, they did what they thought was right. A lot of parents probably were like, well, I just had the best intentions. I didn't know this was going to hurt you. So it's not always very clear. It doesn't have to be, a childhood full of abuse and neglect. It can be something, some smaller, more, maybe you think you're doing the right thing, but really you're restricting their freedom and growth. Anger, feeling frustration or rage towards a situation, others like your spouse or oneself. Why me? It's not fair. How can they treat me this way? And retribution, take them out of your will, which you're not going to have much control. And I think in the book presents that pretty clear. Is the parents, your adult kids take care of themselves now. They don't really need you anymore. And you're kind of at their mercy on whether or not they allow you in their lives, and that makes the situation very difficult. Bargaining, attempting to regain control by making deals. Come back and I'll be different. Of course, without counseling, without if you're a parent, I would get this book, this Rules of Estrangement. It tells you how to be. You are going to have to change yourself and change who you are and how you look at the situation. Um, Depression, overwhelming sadness or despair as the loss sinks in. Sadness, tearfulness, apathy, decreased interest in activities, sleeping more or less, eating more or less, fatigue, crying spells, all symptoms of depression. Um, and you'll most likely seek out treatment and help for that. And hopefully you have somebody that has some experience with estrangement and can coach you on how to cope through that. And even we'll get further as we get further. I'll talk about reconciliation. Hopefully they can coach you on how to reconcile. Acceptance, coming to terms with the reality of the loss, finding the kernel of truth, empathy, understanding, and the finding the kernel of truth is from the Coleman book. He said that's very important for the parents to find, at least look at what the kids are saying, find that kernel of truth, because the kids are just not lying. It may not be what you've seen, or it's not your perspective, it's the kid's perspective, and it doesn't necessarily mean it's wrong. So you got to find that kernel of truth in there and accept that, yeah, maybe I was a little harsh, or maybe I was a little restrictive or critical. It's just kind of looking at that and accepting that and letting the kids know that you see that. It's important for empathy and understanding too. If you come at your child who's trying to tell you that, hey, I can't take your criticism anymore. You come over and you judge me on everything I do and what I wear and how I decorate my house, and I just don't need that in my life anymore. And if you come off with anger or denial, become defensive, the kids aren't, they're not that's not going to help your situation any. You have to be empathetic. You must put yourself in your kid's shoes and see how would you feel if maybe they did, maybe it's generational, but how would you like your mom or dad to come in and be critical of you and just be understanding that, yeah, it's I hurt your feelings, or I wasn't the best parent I could have been. Okay, right underneath acceptance, this means that the parents will necessarily have to find a way to empathize with and comprehend the perspective of the adult child if they want to restore the relationship, while the adult child isn't necessarily under the same obligation. So if the adult child is estranged from the parent, they're under no obligation. It's the adult that's going to have to oblige the child. You want to see your grandkids, well, you have to change for the long term. For the adult child, the decision to estrange a parent, however painful, is nonetheless tied to the narrative of liberation from oppressive forces and the pursuit of happiness. There's no equivalent upside for the parent. It's all downside. Family at life's most important task. Being denied the valued reflection of oneself as a parent, feeling shame before one's peers and family, losing not only the adult child, but often a relationship with cherished grandchildren. And for those parents who are all too aware of their parental failures, they also lose the opportunity to do for grandchildren that what they couldn't do for their own children. Okay. What therapy can do. So I don't know if we'll go through this. So help the client continue, and this book, Rules for Estrangement, it's not written for therapists. It's written for your clients. It's written for the general population. I kind of read through it, and I kind of just try to understand Dr. Coleman and how his approach and what he says works. So I just kind of took some of his ideas. So let's see what we can do for our clients. Help the client to continue their life after the estrangement. How has their life changed? Avoidant, crying spells, isolation. This is some of the symptoms they might come in with. Irritable, grief, loss, rumination. There's a couple different therapy orientations. You got CBT, ACT, mindfulness, homework, journaling, self compassion. Give time for the client to process the experience from beginning to end and ask questions. Careful not to judge, but also don't be careful. Keep in mind that the story they're telling is their perspective and not the child's perspective, and you may have to. We're so I guess we're so attuned or we're so used to, um, supporting our clients and their perspective. But it's gonna be little bit different with these clients. Um, so gather information about the client to find parts of their personalities, histories, and challenges that might have contributed to the estrangement. Help the client to build insight and awareness around these and make necessary changes. The parent can't go back to their old ways. Work on building that empathy, that self awareness, and self reflection. Help them to find that kernel of truth. Read the letter, email, or text from the adult child with the parent to understand how they come to this point and how they have chosen not to be with you. How are you accountable? How did you contribute to the situation? What do you have control over? Reach out to the adult child on behalf of the parent. Example letter. There's a letter in there that Coleman has as an example. But there's a certain way you want to write it, and if your client does write a letter, you want to be able to. I would read it before they send it, just so there's a different perspective or objective. A little bit of objectivity when reading that letter. You want to look out for any kind of, the denial or the defensiveness, or you want to make sure it's full of, empathy, understanding, and the kernel of truth. You want to make sure that they're putting all that in their letter, so they can let the child know that I understood. I understand my problem now. I understand how I am, and this maybe something goes back a long ways, and I want to be better. I want to do better. I want to work with you to improve our relationship, not to go back to the way things were. So sometimes you have to reach out to the adult child on behalf of the parent. Example is a letter. Help the client to write an amends letter. Provide reconciliation for the adult child and parent. If it happens, it may not. Coach parent before reconciliation on what can help the process. Focus on responses, communication, respecting the adult child's demands and goals. Respecting their perception. And then family therapy. It almost needs to happen. I think there needs to be a therapist, family therapist, social worker. There needs to be somebody in the room with them to make sure that the parent is not going back into old habits. So it's almost like you gotta have it, the therapist in there. Um, let's see, reconciliation. Let's see what that looks like here. So the parent reached out with the letter that as a therapist you helped them write. The child, the adult child, actually answered and agreed to reconciliation. So let's see what happens now. It says foster empathy in parents. Encourage parents to show empathy towards their child's feelings, even if they believe the child's allegations are untrue. To create a foundation for reconciliation. This is so important because the child is gonna describe their side of the situation, and the parent probably like, I worked 80 hours a week. I put a roof over you. I put food on the table. They're gonna get defensive. They're gonna look at all the things that they did and they sacrificed, and the child doesn't want to hear all that. They want to hear, I understand. I'm sorry I made you feel that way. You were right. They don't want to hear your side as a parent. Reduce parental defensiveness. Help parents lower defensive reactions, as these can make the child more rigid and resistant to reconnecting. Promote self-examination. Urge parents to reflect on their own actions and consider the child's perspective to better understand the roots of the estrangement. I think that's really important. The parent has to know where this comes from, whether it's a need to control things, whether it's being critical. They have to build that insight so they can catch themselves and stop themselves from doing it. Um, a lot of times, the parents may not know. They may never had any kind of self reflection or examination, so they don't know where the problem is. So hopefully, during the therapy, the one on one, before the reconciliation, you learn all that and understand that. Find a kernel of truth. Even if allegations seem inaccurate, parents should look for some truth in the child's claims to validate their feelings and open a path to dialogue. Avoid hostility. Minimizing hostile responses from parents is key. Hostility can escalate conflict and cause the child to further withdraw, hindering reconciliation efforts. So, don't be hostile. Yeah, that's not going to help. So what can be done for the adult child? Okay. So the first thing, we got to acknowledge the adult child's needs. Help adult children identify what they lack from their parents and what they ideally should have received in support their emotional healing. No obligation to forgive or reconcile. So that's really important. So if you have both of them in your office, and the reconcile is not guaranteed. Maybe the child just agreed to one session, 2 sessions, just to hear the parent out. But that doesn't mean that's going to lead to reconciliation. Now, sure, adult children, and I want to make that clear too. So when you do have an adult client, adult child, you want to let them know that come talk to us, come talk, me and your mom, me and your dad. You're not under any obligation. Remember, the children aren't obligated for nothing. To forgive, to reconcile, you're not obligated to do that. You're not obligated to forget, but only to consider engaging in dialogue with the parent in therapy. So that's why it's really important to coach your client, your mom or your dad, to say, okay, this is what you have to show that you understand where the problem is, what your child's been trying to tell you. And you have to really show authenticity in making changes and wanting to be different. Don't just fake it and then get reconciled and then you go right back to who you were. No, you can't. You can't do that because they can just easily estrange again. Prioritize psychological well-being. Recognize that many adult children view estrangement as essential for their mental health and respect their perspective during the therapy process. Ensure a safe exit option. Reassure all adult children that they can return to estrangement if they feel reconciliation is not working, giving them control over the process. And I would let the parent know too. Let them know that they're not under any obligation. They can go back to estrangement anytime they want. And empower the adult child to set terms. Allow the adult child to define the boundaries of any potential relationships, such as the frequency and duration of contact with the parent. Limit commitment to therapy sessions. Clarify that agreeing to family therapy does not obligate the adult child to maintain contact with the parent beyond the therapy meetings. Okay? So again, you're setting these boundaries and limits with both the client and the client's child. If the child, maybe just starting out, this is pretty restrictive here, but if maybe it'll get better over time. But again, there's no obligation to the kid, to the adult child. Establish guidelines for future contact. If more contact is considered post-therapy, work with the adult child to set clear guidelines for how the relationship should proceed. Okay. Going against the grain as a therapist. Okay, I want to put this out there because I think in order to help your client who comes in, an estranged parent, depressed, there's certain things from what I got from Dr. Coleman's book that were kind of not what we usually do. So it's something that you're going to feel a little awkward doing, but you got to recognize the legitimacy of the adult child's complaints. Therapists should validate the adult child's grievances rather than accepting the parent's narrative that the child is entitled, disrespectful, or self-centered. So if they bring in a letter from their child and it's all these grievances, okay, it's I think sometimes as therapists we tend to say, yeah, I don't know why your child's acting like such a baby or spoiled, or you know, you have to kind of say, all right, we gotta look at these as real deal. These are real grievances, and we have to take them seriously. Um, so you want to recognize that. You don't want to just go with your client. You don't want to just, I mean, you are on your client's side, but I think being on their side, you have to kind of, let's come down, let's, I don't know, come down to reality and look at this as a real grievance. Avoid affirming parental narratives. Refrain from endorsing outdated assertiveness approaches that encourage parents to set rigid boundaries, demand respect, or empathize their past efforts as parents. Assertiveness communication, really important for anger management, for um, relationship issues, using those I statements. Again, if you're showing that, you might you might scare them away. So you want to be careful um, with using those outdated assertiveness approaches. I think that even might be like a first approach a parent might have. Is being assertive and saying, "Hey, I'm your mom. You can't do this. You need to respect me. It's in the Bible, and you don't want to go with that, and everybody deserves respect, of course, and everybody has their rights, but you got to be really careful with those when you're dealing with estrangement. Address the adult child's valid needs. Focus therapy on helping parents understand and respond to the legitimate needs and requests of their adult child to facilitate potential reconciliation. Seek the kernel of truth. Explore the adult child's claims objectively, looking for elements of truth without assuming the parent's innocent or guilt. Challenge idealized parental misconceptions. Confront parents when they present themselves in an overly idealized light, addressing discrepancies between their narrative and reality. I was the best parent ever. My kid never went without. I even bought them a brand new car on their 16th birthday. Okay. This is parents being defensive, and it's like they're not able to see that maybe they weren't that great after all. I wouldn't say like bury their head in the sand. I just think sometimes it's they their idea of what a great parent was maybe wasn't the same as their child. I don't know. You just want to make sure that you don't you want to make sure you don't when they're as therapists we want our clients to think positive themselves, and we want them to say, hey, I don't know, I guess maybe it is kind of backwards, because when you deal with a depressed person, usually they just see themselves in a negative light. They do everything wrong, or they can't get anything right, or no good. I'm worthless, and you're like, no, look at all these good things you're doing, and it's just kind of the opposite. They're gonna paint themselves in this rosy-colored parent of the year, and you want to make sure that you take the letter and you take, well, this is what your child thinks. This is, what she says is valid too. Okay. Maintain therapeutic objectivity. Therapists must remain neutral, avoiding taking sides to ensure balanced approach and supports constructive dialogue. And that's, I think, if I'm not a family therapist, I'm a professional counselor, but I think most family therapists know that you don't take sides. Your client is the family. It's not any one member. And even though you're working with the mom or dad initially, when you get reconciliation going and the adult child comes in, now your client is a relationship, and you got to think what's best for that relationship. And is it her parent coming down to planet Earth and understanding the reality, and that they did some things wrong, being empathetic, being understanding. There's not a whole lot of obligations for the child to make any changes. So it's certainly it's a complex issue, and it's probably not as easy as it's probably easier to do a YouTube video on it than actually do it. Confront, don't affirm the client. Okay, guide parents to critically examine their role. Let me. This is the big one here. Confront, don't affirm the client. Okay. Guide parents to critically examine their role in the estrangement, rather than reinforcing their existing beliefs, fostering accountability and growth. Okay, so again, it's kind of a little bit different than what we're used to, but they sometimes they might even difficult. Some therapists don't like to confront, um, because you don't know how the patient might react. They might get defensive with you, and are they whose side are you on? Um, that's what. Oh, my cat's having a hairball. That's just part of our role. Sounds terrible. All right, I think that. Oh, that's my dog actually. Okay. All right, that's the last slide. So that is, yeah, estrangement. Okay. Um, so just a little, disclaimer. I'm not your therapist. This is just for education. Please, if you need help, seek out a therapist. You can go to Psychology Today. They have a list of all therapists in your area. Go get help. There's people out there that'll help you. And estrangement is not something you can do on your own. And I think it's because it takes a little bit of talk therapy to understand what your internal problems are. You got to change yourself, and a lot of strange parents might not know. Well, what do I need to change? So get help, and also like and subscribe. Please comment if you have any experience with this. I'm not a specialist in this, but I've had a couple clients that have helped with this. So please leave any kind of comments below. Let me know. But that's all I got for you today. I appreciate you watching. Have a great night.